With the coronavirus pandemic ongoing, but cases thankfully declining in the US and other Western nations as a result of the vaccines. Now, vaccines are fantastic. They're wonderful. You should absolutely get vaccinated 100%. Now, as a result, though, there was another thing that happened as a result of the vaccines, and that's the pharmaceutical industry getting rich. And specifically, the industry itself welcoming 9 new billionaire CEOs to the ranks of the other billionaires. So now this is according to an article in Agence France Presse. Profits from COVID-19 vaccinations have helped at least 9 more people become billionaires. Billionaires. Between them, the 9 new billionaires have a combined net wealth of $19.3 billion, enough to fully vaccinate all people in low-income countries 1.3 times, which would be incredibly helpful, especially in places like India, who are suffering a massive spike in COVID-19 with the Indian variant, which has been incredibly devastating. Now, this is according to research by the People's Vaccine Alliance. Now, they say that, and by the way, the Alliance is a network of organizations and activists that campaigned for an end to property rights and patents for vaccines for inoculation. And so what they did is they took they looked at the Forbes rich list data, and they said, well, this guy's a pharma CEO for this company and this company and this company. Look how much money they made during the pandemic. In fact, there was more. Anna Marriott from charity Oxfam, which is part of the alliance, said this: these billionaires are the human face of the huge profits many pharmaceutical corporations are making from the monopoly they hold on these vaccines. In addition to the new mega rich, 8 existing billionaires have seen their combined wealth increase by a total of $32.2 billion as a result of the vaccine rollout. Topping the list of new vaccine billionaires with the CEO of Moderna, Stephanie Bancel, and his BioNTech counterpart, Ugur Sahin. 3 other neo-billionaires are co-founders of the Chinese vaccine company CanSino Biologics. And they say China's communist. Yeah. No, they're what was there, socialist with Chinese characteristics or something? I think that's how they describe themselves now. But anyway, more billionaires. Because that's just what the world needs. Billionaires. More people buying yachts to park in their other yachts or their super yachts as the developing world continues to get ravaged by COVID-19. Fantastic. Yay, capitalism. Woo. Wonderful. So let me just note, by the way, that because I know there's some people that, well, of course, why does it matter that they're billionaires? I mean, they made their money. They developed the vaccine. No, they actually didn't. In most cases, the American taxpayer funded the development and research of these vaccines. Not only that, but also after the vaccine was developed, the United States government then purchased these vaccines to then hand out for free for regular people, showing that, of course, the government, if it actually wanted to, could actually give people and pay for insurance, health care for the American people, like, for example, under a single-payer system, that they could actually manage and do that. When the Biden administration took over from the Trump administration on vaccines, it was a train wreck. But then the Biden administration actually was able to get it going, and now you have millions of people that are being vaccinated. In fact, the only issue that we have with vaccines now are the number of Republicans that are refusing to get vaccinated. So the rollout has actually been a lot better under Biden than it was under Donald Trump, showing that, of course, under the right management, government can actually do these things. So that said, with the government using taxpayer money to then purchase those vaccines from these private companies, you end up having these private companies and their CEOs and executives getting incredibly rich. Now, the thing is that these CEOs and board members did nothing to actually develop the vaccine at all. And that's kind of fucked when you think about it. I mean, why are people allowed to make profit off life-saving medications? I understand that you need to pay people for the cost of research and development to actually do the physical work, but like, as well as the mental work. Again, the research. I'm not talking about that though. I'm talking about profit, pure profit. Like, hey, I'm a CEO and I just made money off the pandemic because my company sold a vaccine that was developed in many cases, from money given to us by the taxpayer. And now I'm selling that vaccine back to the taxpayer, and now I'm somehow a billionaire genius. That is really, really messed up. Again, he didn't do anything, or she, to do anything. They didn't do anything for the vaccine. They just held the patent. They just held the so-called property rights for it. And that is really messed up. And it's especially messed up when you consider the countries that cannot afford the ransom, and that's what this is, to purchase these medications, like smaller countries, for example, maybe in South America or Africa, dealing with the COVID, outbreaks. Or think about in places where we have decided not to trade with, Cuba, Iran. Look, they're full of people. People deserve the vaccine. I understand that the Iranian government is pretty fucking horrible, and they're a fundamentalist country, and they're not exactly fans of us, okay? Guess what? I don't give a shit. They're people. They deserve the vaccine. By virtue of being a human being, you deserve health care. You know why? Vaccines are a human right. Healthcare is a human right. I don't care where you're from. I don't care what you believe in. I don't care who you are. You deserve healthcare. You deserve vaccines. Simple as that. Simple as that. All right. My position is actually pro-life. Weird. Not only that, but the other thing is this: if you actually give other countries the vaccine, you give them, not sell them, but you give them the vaccine. That makes it less likely for there to be a disastrous mutation in that, of course, in that virus. All right. And so that makes it so that it can't mutate, evolve, or come back to reinfect the population. Because again, I don't know if you need a booster necessarily. I've read that it is possible that the antibodies maybe last for like 6 months or something like that, and you need to get a booster, which of course means more profit for pharmaceutical corporations, which means of course more billionaires. But don't get me wrong. Again, I want to make sure to let you know that I'm pro-vaccine. Get your vaccination. I got mine. The science is 100% solid. The problem here is the business model, the CEOs, the profit motive, the corporations. Profit motive in healthcare just shouldn't exist. It just shouldn't exist at all. Okay? I think pharmaceutical companies should be nationalized. I think should be public for nonprofit entities with all the funding that they get going towards making cures, vaccines, doing research, and paying their staff, paying their scientists very well. The people that are actually doing the real work. All right? And not the billionaire CEOs. Because I've said before, billionaires are not necessary. We don't need billionaires in this country or anywhere else in the world. Every billionaire is a policy failure. It is resources that are being wasted on one person as opposed to many more people. How many people could get vaccinated with, just a salary made during COVID-19 alone for these CEOs? Exactly. Abolish billionaires. If you enjoyed this video, please give us a like and share with your friends. You can subscribe and help out the channel by becoming a patron. It's patreon.com/Jeff Waldorf, or you can become a channel member as well by hitting the join button below.